Medicare for all, such a deal. Hey, let's talk about this for a moment. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, first off, let's say this is not a political discourse. I'm not going to get into whether it's a good thing or a bad thing, or this candidate wants this or that or so forth. So, stick around. You might just learn something. Medicare for all is certainly dominating the conversation a lot, especially because it is an election year, and it seems like everybody who's running for office anywhere wants to give away as much free stuff as possible. And let's start with health care. It's interesting because a lot of folks who are wanting Medicare for all, and it's not just the young people. I hear and talk to folks who are in their 40s and 50s that say, enough of this Obamacare stuff. I really want Medicare for all. I think this is what we need, and this is certainly what I need. And a lot of these folks believe that Medicare is free. Let's burst that bubble right off the start here. And this includes folks who are just a few years away from Medicare. As they get closer and they start looking into it, they're surprised that, what do you mean I have to pay for this? I thought Medicare was free. Well, no, it's not. Even though most of us have been paying for Medicare by way of FICA taxes and Medicare taxes, been paying payroll taxes, let's say, for a number of years, that is just for Medicare Part A, which is the hospital portion. When you get to 65 and you want to go on Medicare, regardless of whether you want original Medicare or you want a private Medicare plan, also known as Medicare Advantage, you still need to pick up Part B. That's a requirement. So not if you just want original Medicare. If you don't care if your outpatient charges are covered by Medicare, well, then you don't have to worry about it. But most folks do want the Part B coverage, which currently is about $145 a month. It changes every year, but it's a great deal. I mean, it really is a great deal. But the folks who want Medicare for all have been sucked into the rhetoric that says, I can go to any doctor anywhere. I don't have to pay anything for health care. I don't have to pay anything for medicine. I don't have to pay anything for anything. It's just all free. Let me burst your bubble. That's not the way it is. First off, Medicare for all, if it even comes about, and I don't think it will more likely resemble Medicaid, which is the program. It's a combination federal and state program that is for mostly low-income people. There are a few other exceptions, but it's mostly for low-income people. And one of the differences in Medicare and Medicaid is this: almost all doctors and hospitals take Medicare. Only about maybe half of the doctors take Medicaid. So you're automatically cutting back your access to health care by about 50%. If you are on Medicare, or if we end up with Medicaid for all. The reason why Medicaid is less expensive is because it pays less. It actually pays less than Medicare does. So there's a lot of doctors out there that, in addition to the bureaucratic mess associated with taking Medicaid, their reimbursement is a lot less than Medicare. So, and the folks who are talking about, well, we should expand Medicaid and that will save a lot of these hospitals. No, it won't. Hospitals lose money, especially rural ones. Hospitals lose money on Medicaid. So there are hospitals out there that are in areas where a large percentage of their population is on Medicaid, and they're closing their doors, or they've already closed their doors. So the Medicare for all most likely will be Medicaid for all because it costs less to the government. There you go. There's a cost to us, and it's not just the folks who use it, but it's try and use it, and you'll find out it's not all that great. Okay, Medicare for All, again, has been promoted as a program where everything is free. There is no such thing as a free lunch. Even people who are on Medicare now know that they have Part B premiums. They're going to have co-pays. They may have deductibles. They may have insurance premiums for a supplement plan, for a Medicare Advantage plan, and for a drug plan. So there are costs associated with it. It's not all free. Here's the other thing, and this is the one thing that really rubs me, and probably the same is true for a lot of folks that are my age. We've been paying into Medicare for 30, 40, 50 years, maybe further, maybe longer. And all of a sudden, these folks come along who are 20, 25, 30 years old, and they say, well, we want a piece of the pie too. We think we deserve it. What makes you think that you can go to the head of the line just because some politician has promised you something that you think is free for everything? That really grinds on me. And, I'm sorry, I've paid my dues, as have all of us who are on Medicare now. We've paid our dues. Don't try and cut in line. This is not the way it's going to work. But if by chance, and I think it's a long shot, if by chance Medicare for All comes along, I think there's a lot of people going to be disappointed in it. And access to health care, even for those of us who are on Medicare already, may find that our style's going to be a little bit cramped. So, let's not let the folks that are screaming for all the free stuff, including free health care, let's not let them ruin the party, because we have been waiting for this moment. We have earned our right, basically, if you want to know the truth. So let's not these other folks come along and ruin the party for us. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care and have a great day.